We have an amazing presentation for you today. We are super excited to have you. I hope you've all been enjoying your second day at SAS Innovate so far. We've got an awesome presentation from Petra Solman and Antti Heino about keeping people healthy and happy in their workplaces. But before I go into too much detail, I'm going to pass it on to you guys, and you guys can take it from there.
Thank you. So, it's so nice to be here. I'm really honored to be here, and it's good to see so many are interested in hearing what we have, what we are here to talk about. So I'm Petra Solman, and I'm. Sorry?
Keep going.
Okay, yeah. So, and I'm here with Antti Heino.
Yeah, hi everybody. I'm working at SAS as a principal AI advisor and helped Petra in this project we are gonna discuss today about.
Yeah, so we are going to talk about how analytics is used to identify health risks and to prevent work disability. And our topic today is keeping people healthy and happy at workplaces. And our agenda today, first, a brief introduction to Keva, the company I'm representing, and its mission in preventing work disability. Second, something about building better predictive models to support our strategy. And then turn to Antti, and he's going to fill in more details about our project's text analytics part and what kind of value it provided us in the company. So let's start. First, a few words about me. I have sort of like a 25 years experience as a data scientist, mainly in finance and insurance. I originally thought that I would become a physicist, but then I suddenly liked applied mathematics more. I have like 15 years experience of using SAS and especially large data in various contexts. And I only recently started working on my PhD because at this age I finally found out what I want to study, and that is disability risk, and doing the research with register data. So, and our company, Keva, is the largest pensions provider in Finland. It administers the public sector pensions, has 1.3 million employees, customers, and a little bit less than 2,000 employer customers, so the employers of these public sector employees. And so Keva also has a legal duty to diminish work-related disability risk. And the next slide gives a little bit background to this, because I'm pretty sure you're not so familiar with Finland and what kind of population we have, what kind of pension system we have, and so on. So for a brief background, Finnish workforce is aging rapidly. The old age dependency ratio on the right side, the lower figure, is now highest in the European Union and rising. And currently, 1/3 of workers leave the workforce before their old age pension. That's the pie there is an example. It's what kind of pensions the municipality workers took out 1 year. So you can see it's 69% old age, and the rest is different kinds of disability pensions. So that's a big share, and we have to do something about it. So, and it is actually estimated that the total annual cost of work disability at the moment would amount to 4% of our gross domestic product. And of course, in addition to all this, losing your work ability is a personal tragedy for the employees and the families. So that's why we have this legal duty to do something about it, since we're the public sector pensions provider. So what we are doing, what kind of work we can do to diminish actually the risk? Well, first we have to recognize it, and we have to be able to measure it. We provide tools for the employers that help them in recognizing, assessing, and quantifying the disability risk in the employee population. And because it's really essential to recognize those groups that are at the greatest risk of losing their work ability. we need to be able to predict. We need to be able to say, now we are perceiving this kind of behavior, and we can say that this leads most probably to this kind of cost or this kind of amount of pensions in a few years if nothing is done. So from the employer customer's point of view, they need up-to-date information, predictive information, comprehensive information about how their own employees' risk is quantifiable. So they need that info in budgeting, in work healthcare collaboration, and most importantly in this context, this early intervention. So during the last 3 years, we were actually a new company level strategic goal was implemented. So they stated that we need to be able to measure the effectiveness of our work disability management policies. And of course, that's a word that gets thrown out a lot. We're measuring the effectiveness, but what does it really mean? If you want to measure the effectiveness of something, you need to be able to build a model that actually can capture the variation of the risk so well that you can make measurements at different time points, and then you can say that now this thing has changed, and we can pretty comfortably say that some kind of intervention might be behind this change. So we need to have enough variables in the models to be really able to describe the risk and the changes. We have tools. We had these old prediction models, which were really popular among the employer customers. They really needed those because they wanted to know how big a share of their current workers are going to go to pension, so they can budget, they can do their human resources planning and so on. But they were mostly based only on socio-demographic risk factors of pension behavior. So it means like this basic gender, age, occupation, and so on. And while these models were robust, or are robust and very well adapted, they provide limited insight into the different factors. We wanted to include more factors so we can actually use those factors also in quantifying what share of the risk actually is dependent on this and this and this. And we were specifically after factors that describe a person's health and motivation, because those are the kind of things that are not readily available from register data. And what we did, we started a project, and we wanted to assess how our models could be enhanced if we were to acquire certain new data, and because it's costly to get new data. We need to build pipelines to get them. We need to get over many legal hurdles to be allowed to handle health data. So it's costly and it takes time. So I don't know how familiar you are with doing research on health-based register data, but it is, at least in Europe, today it's very hard. So we had to sort of show that what we can do if we get this new data, what we can do about it. So we wanted to quantify the association between new risk factors, which were, in this case, sickness absences and some risk and health and motivation-based markers from text data. And then, after that, we should build tools, practical tools for the employers, so they can actually measure their own risk. They can have a snapshot figure, and they can have prediction how it's going, and also, very importantly, they can estimate the effect of any kind of change in terms of costs. So this project was tasked with gathering a large sample data and build these models and presenting prototypes for interactive risk management tools. So that's what we did. We had a sample of a little bit more than 200,000 public sector workers, 7 years. And our basic data, employment spells, wages, occupations, other social demographic data, pension applications, and these blue boxes represent the new data we wanted to try. So we had these date-specific sickness absence spells, and we had the doctor's notes for pension application decision. And this is the part that Antti will, after me, he will delve deeper into that subject. It's really interesting. Well, with these analytics tools, we were able to very quickly, we were really short of time, we were able to really quickly import this data and incorporate it into those models, compare different competing models, and tell what of those factors, there are dozens of different risk factors, what factors we want to include into our models so that they are most informative to the employer customers. And as a result, this is one result was that adding these two kinds of data, the prediction performance of the main model was enhanced by 8% and accuracy by 29% with the sickness absence data alone. And then adding the factors from text analysis further, the prediction power was further enhanced by 6% and the accuracy 1%. Of course, these kind of figures might not sound okay, that's only 29%. But if you're familiar with prediction models and what kind of enhances in the prediction power usually introducing some kind of set of new risk factors brings, this is quite good. So we were mostly really happy because it was so fast, it was so efficient, and we could draw these conclusions really quickly. To conclude my part of this, with this help from SAS Analytics, we were able in this project to very quickly analyze our augmented data, build competing risk assessment models, and compare the performance, and recognize those risk factors we wanted to incorporate into our new models. And this encouraged us to build a set of tools in form of interactive visual reports for the employer customers, and customers were really happy with them. They took them readily into use, and in human resources management, planning, budgeting, and workplace healthcare collaboration. And the results are already very widely utilized among the Finnish public sector. So this was all in all a very successful project. And in addition, some of our recent work in the risk forecasting and the applications for the public sector have been recently published in that link. I can guess you get the material for you after this presentation. So if you're interested, you can take a look at it. But now, Antti will continue.
Yep. Thank you, Petra. All right, then to the next part of our presentation, the value of text analytics. So I'm going to continue on the same story that Petra has been talking about, but now focusing on the text analytics piece of the project. And my role was to help and support Keva in this project, especially related to the text analytics. So that's why I'm supporting Petra here today. So 3 things I want to tell to you today. So how did we use it? How did we use these text analytics capabilities in our tools? Then a little bit about visual analysis of the results, and then a couple of additional words regarding the sort of better predictive models that we were able to build using these new features we were able to extract from the free text. All right. So how did we use text analytics? So to understand how we used it, I think it's useful first to discuss a little bit what we actually mean with text analytics. So there is a lot of this AI hype going around these days. So it's good to understand sort of how these different terms relate to each other. So at least AI to me is this field of science that trains computers to emulate human tasks through learning and automation, basically. And then you might have heard about also natural language processing. So NLP is basically a subset of AI that focuses just on the language part of this learning and automation. And then text analytics is again part of NLP, and that focuses on creating structure. So we want to create structured data from unstructured documents, as Petra has been saying, and use those in the predictive models or in a visual analysis type of way. And our focus today is the text analytics part of this equation. So there are roughly two types of things that usually we want to achieve with text analytics. So one is information extraction. So you can imagine things like, so in information extraction we extract, as the term says, we want to extract something from text. So you can imagine, let's say, annual reports of companies. We want to extract like the growth numbers, what's the percentage share, what's the revenue last year. In this context, in the health and pensions context, it can be like from the doctor's note, it can be like how many years a person has been suffering from an illness, let's say. That's information extraction. Then pattern discovery, it's a little bit different. We are not extracting anything, but we are classifying. So we are classifying different documents into different categories and try to, in that way, sort of create structure out of the unstructured data. And that's mostly what we are focusing in this presentation, although in the project we also did some of the information extraction part as well. But it can be anything like classifying the sentiment of the documents, but exploring topics or clusters, creating sort of different types of categories out of the documents to classify them into different illnesses or risk categories or these sorts of things. And what I want to highlight also, especially as we are now discussing a public sector example, is that explainability, of course, is critical. Every time we look at anything related to health data, it's really important that we are able to explain where we are getting the results we are getting. And this sort of consistency and explainability is achieved with this hybrid approach that we try to bring into all of our products. And it's just sort of a fancy term to say that we are able to bring in these machine learning AI-based approaches and these linguistic rules in combination to do this text analysis and bring structure to the documents. Okay, so then let's dive into the actual value of the text analytics. And of course, we want to create this new information about the new risk indicators for modeling purposes and also other types of analysis purposes to then understand better this phenomenon of early retirement risk. And why we want to do this is that all information for this risk modeling it's just not available in structured format. There is all types of restrictions, of course, in the real world, but also other types of issues. So there are 3 points that I want to make here. So first of all, it enables us to get entirely new risk indicators, because the doctors who are seeing the patients, for example, and doing the evaluation whether somebody should go into early retirement, they cannot record possibly all the sort of important things into structured data. So a lot of the information is hidden in the doctor's notes. So that's why we are able to, with using text analytics, we're able to extract these entirely new risk indicators. But text analytics goes also beyond that, because there can be also discrepancies in the structured data that is recorded, because doctors and all the personnel involved in this process are only human. They are different, they pay attention to different things, and that's why it's really useful that we are able to then come with text analytics, come the data, see, analyze, what are the risk indicators that they have been discussing about in the notes, and make them sort of more uniform across different doctors, different years of recording the data. So we are able to sort of predict or better the data quality and do better quality predictions based on it. And also finally, we can also get new data points more quickly, because another option would be, of course, to implement some process changes and start gathering this new data, but that takes a long amount of time. It might take a year or two at least to get any usable amount of data from the processes. But with text analytics, we can immediately apply the new categorizations to the historical data and start using that for research straight away. What I also want to highlight is, I think Petra might have referred to this already a little bit, but what is crucial for success is, I think, a collaboration or this interdisciplinary collaboration. So we brought sort of the data science expertise to the equation, but Petra and her colleagues worked a long time building sort of this taxonomy, reading research papers, working with the medical doctors to sort of understand the terminology in this type of case, and understand the process, what are the risk factors the doctors themselves are looking at, and in that way sort of enabled us to create better assumptions about what should work in this type of context, and build more relevant risk indicators that we can use for the modeling purposes and build valuable information. All right, so that was the first part. Then I have a couple of examples of the visual analysis part that we did in the project. So these are just a couple of examples, illustrative examples. Don't take like that the data is exact or anything. It's just for illustrating different concepts we were looking at during the project. So here is, for example, then the first thing is monitoring, for example, these new risk indicators over time. So now that we have more detailed information, you can think like Petra mentioned, like before they might have had only like age and gender, this occupation, these very high level things. But now we can find things like mentions of depression, let's say, and find those mentions in the doctor's notes. And then we are then able to monitor these problem types over time, especially for different employment types or areas, and see where let's say their prevalence has been low previously, and suddenly, as you see on the chart there, we can see, for example, in a particular city or employment type, we see a spike of depression cases. And then we can start to analyze, hey, where is the cause of this? And maybe also plan for corrective actions. Because if we are not noticing these problems as they occur, they can last for several years before something is done to better the situation. And at that point, several hundreds of people might have gone to early retirement, and we have wasted millions of euros or dollars. So that was one example. The second example is also geographical factors. So there is sort of these geographical elements to different risk types. Different areas in our country are different, and these risk factors can also correlate. In some places, in some cities, they can correlate. In some cities, they don't correlate. And this type of information can help us, let's say, analyze. So here's an example of depression and alcohol issues. So if we detect a rise in one issue, with this type of information, we can expect that a rise in the other issue will likely follow. So if we are able to sort of tackle the first issue, we might not see rise in the second issue, and that way again promote more more healthy working lives. But I think like with this type of information, it's sort of important also to recognize that we are able to plan programs based on these areas more efficiently and target them, because the other option would be just to run sort of these preventative campaigns across the whole country and just hope that sort of something sticks. But with this type of information, we can really see that, hey, this issue is relevant in this employment type or city. Let's build a targeted program to fix that issue in that city, and then spend sort of our resources more wisely. Then a third and final example is understanding different types of effects related to employment types and regions. So we did a lot of, like I mentioned, a lot of terminology. One aspect of that terminology was, for example, related to shoulder and neck problems, which is really common cause of problems, headaches, all sorts of related issues that come around from that. Also, we looked at, for example, obesity rates that change also by employment type, but also regionally. And on the right-hand side, you can see some examples like how the different shoulder and neck problems, for example, vary by the employer or by occupation. The occupation names I think are in Finnish, but you get the point that sort of these shoulder and neck problems can be very relevant for a particular occupation type and not at all relevant for another. And we should use this type of information to then again execute more targeted programs related to the problem types and sort of influence these problem types in advance so that they don't sort of evolve into a too bad state. Great. So that was sort of the visual analysis part. So I think that sort of examples are helpful for understanding the data better, but also to build these visual tools for the employers so they can understand their own situation, look at the most relevant risk factors in a visual dashboard way. But of course, what we wanted to do also in this research was also to create the better predictive models as well. There is not much to add what Petra said, but what I want to reiterate here is that based on the understanding, the visual analysis of the results, then we were able to then incorporate these new risk factors that you just saw in the examples. We were able to incorporate those into the risk models. And what was, I think, especially interesting and valuable to notice is that these risk indicators that we were able to extract from the text were actually among the most important predictive variables in the models. So that tells us that the information we are able to extract from the text is extremely relevant to describe this phenomenon of the early retirement risk. And of course, with the more accurate predictive models, then we are able to sort of do these more targeted actions and also spend our money, limited public money, well and target the problems that are relevant in each employer in the public sector. All right, then we have a summary, some key things we want to leave you with today. So some of the success factors, I think what are important highlight is I think the interdisciplinary collaboration. So success requires many types of knowledge. So it required our data science knowledge, it required the medical doctors, it required the legal experts who needed to sort of be involved to understand what type of data we are able to collect and analyze. We needed people to install the platforms and so forth. So it's really a group effort of many people to get to these results. And the second point is that access to data is extremely important. Like Petra mentioned, she showed the sort of great improvements we were able to make in the predictive power and accuracy, with adding more crucial data to the models. So that really shows how important like data sharing is in this instance, because with more data we are able to build more robust predictive models and sort of then have the better outcomes in the end. And also the role of information extraction. If you cannot share more data with other public sector organizations, at least consider if there is unstructured information, this text data, that you could utilize and get new information out of that, and use information extraction to sort of get new information to understand your phenomenon and risk types maybe that you are working with a lot better. And I'll let Petra actually say the final word and about the.
I'm not sure if my microphone's on. Okay.
Yeah,
So
it is.
yeah, the final point is that these are really the ways to accelerate research. In a large company that has, we aren't a research organization by nature. We're a pensions company. But so in order to really start doing something bigger, we need tools for accelerating research, for kickstarting something. So we were really able to do new things quickly and get these new tools to the customers in a really reasonable time. So all in all, this was a really successful project we did with SAS.
Yeah. All right, that was it. We thank for the attention, and I guess we welcome any questions. And
Yeah,
Petra
thank
can,
you everyone. Thank
yeah.
you Antti, thank you Solman.
Thank you.
If there are any questions, please raise your hand and we'll come over and bring the mic. I see we got one over here.
Hi, I'm just curious if you can talk about this, but basically, did you find any type of correlation between income and the age of retirement, or
Yes,
and,
yes.
and also years of education, and whether there was a difference between the whether you worked at the public sector or private sector? So you can elaborate on that a little bit?
Yes, a little bit. Thank you. A little bit. So, income is remarkably a thing that dictates the risk of being disabled or leaving the workforce early. So, it's tied with occupation, because certain occupations are tougher on you, both or either mentally or physically. And many of these occupations, for example, nurses, aides, they have a lot of disability. They have a lot of musculoskeletal problems because their work is hard, and their wages are not that high. So they tend to sort of correlate a little bit. And then there are some sort of experts. They might have stress-related problems, but their income level, let's say in a public sector, different sorts of lawyers or researchers or someone, they have lots of stress, but their disability rates are a lot lower, and their income levels are higher. So that's certainly a thing. And we didn't measure the years of education as such, but the occupation gives you something about it. So, for example, a teacher, they have a master's degree in their field in Finland. Then there are nurses that have a few years of education past high school. Then there are construction workers who might only have professional, or how do you say, trade school here. And then there are researchers who have postgraduate degrees. So you can say something about it. But I think I covered that pretty much when I told you about different occupations and income levels. So they're mixed up a bit.
All right, and we have another question over here.
Hi, thank you very much for this. I'm curious, from concept to data collection, not data analysis or extraction, how long did it take you to develop the concept, develop the structure for the data collection, and all the parameters you're going to work with?
Well, let's say first we had our old models that we've been developing for years. So we had some background already, and we already kind of knew already what we are looking after. So we had a hunch. It wasn't a completely empty canvas. And well, the data collection, it took time because there's lots of paperwork. So you have to have basically research permissions to handle health-related data. That took a very long time. We were surprised how long time it took. But after we had the data collected, the analysis part and the extraction part was surprisingly brief. It took a few months. And then we presented our results to the directors, and they decided to put into production those tools. We had the concepts for certain tools, and that took a year, and now they are in production.
More questions in the crowd? We have some time. If not, thank you so much, Solman, or Petra. Thank you so much, Antti.
Thank you. Thank you for coming.
Everyone, give it up for them. They've done an amazing job today. We appreciate you all stopping by. We're going to have another presentation here very shortly, so don't go anywhere. We'll be right back.